we need to do, in order to prevent and post-transplant malignancies. Risk factor modification, stop drinking, stop smoking. You need, for viral infections, you need to be tested to make sure that you don't have CMV or a lot of EBV is always positive. Once it's positive, it's always positive, but they can count the number of copies of the number of viruses in your blood. So you want to use antiviral prophylaxis within the first 3 months of transplant, and we do it actually we do it for 3 months for everybody. Cancer surveillance is probably the most important thing. Derm, having a colonoscopy, having your GYN exams, men having a prostate exam, and breast cancer in females. So one of the things I didn't say that's very important to note is that it is true that prostate cancer grows slowly in your average man. Okay, prostate cancer grows much more quickly in someone who has immunosuppression on board. All right, so cancers grow more quickly on people whose immune systems are suppressed.
What is up in risk factor modification? E, avoid voriconazole.
So voriconazole is it's a medicine. It's an antifungal medicine, and so there'd be no reason for you to take it unless you had some sort of weird fungal infection. So that's just doctor speak stuff. People don't usually get voriconazole. If you do get it, it's...
Is it strictly treatment for a fungal infection?
Yes.
If you were going on a trip to third world country,
You wouldn't get one.
you wouldn't get it prophylactically?
Nope.
Okay.
You wouldn't get that. Statins are, Lipitor, things like that, are associated with a decreased risk of cancer. That's why everybody, all the heart transplant patients are on a statin.
Lipitor is associated with decreased risk of cancer?
Absolutely.
Really? I thought it was, that's good news, I thought it was just there because they knew I had a chance of getting plaque and
Nope, that's not why you're taking it.
Oh.
And that's all statins.
I'm
Yep.
kidney pancreas at Penn, and I'm not on it. And I don't have high cholesterol, which is another reason to put on it, but
Right, so that
it's
is...
not in the kidney program?
So, I'm actually not sure about, I know that it's true for hearts.
Okay.
I'm not sure whether or not it's true for kidneys, but I can look that up and I can easily get back to you.
All right, I can ask my doctor.
I seem to recall, and I'm not sure if it was statins or not because it's way back there now, that they sort of discovered that if you go back 20 years ago, a lot of the loss of the hearts was because of the hardening of the arteries. And by using statins, they seem to avoid that. They didn't know why, but by using statins, they didn't see that happening. And so along with, we think in terms of cholesterol and so forth, but in hearts, they found that was a preventative for a very common concern. Do I have the right drug?
So yes. So it definitely helps to prevent atherosclerosis, and everybody develops atherosclerosis with age. And again, with immunosuppression, it tends to go faster than with people who are not on immunosuppression. But even irrespective of the disease of the arteries of the heart, it is associated with a decreased risk of cancer. Okay. All right, and then the making sure you're vaccinated and that you get your acyclovir or ganciclovir, whatever you're using to prevent herpes-related viruses while you're on such high suppressive therapy. And I think the highlights: cancer is highly prevalent in post-transplant populations. Skin, lung, PTLD, the most common cancers. Risk factors include age of transplant, how long you've had the transplant, what your sex is, and having a prior cancer. Medications and treatment for rejection can have an impact on malignancy. Having a post-transplant malignancy can lead to poor outcomes. Post-transplant malignancies tend to be diagnosed late, so screening is the most important tool for diagnosis. Knowledge, education, screening equals power. All right.